Dynorphin and disorder, stress, pain, and negative emotion. Dynorphin is part of the brain's endogenous opioid system, but unlike endorphins and enkephalins, which are often linked to pleasure and pain relief, dynorphin is more closely associated with stress, discomfort, and negative emotional states. This makes dynorphin a particularly interesting transmitter. It shows that the brain's opioid system is not only about pleasure, but also about regulating aversion and stress. So what happens when dynorphin systems become disrupted? To understand this, we begin with its role in the brain. Dynorphin is a neuropeptide that binds primarily to kappa-opioid receptors. These receptors are widely distributed in brain regions involved in emotion, motivation, and stress, including the amygdala, hypothalamus, and areas of the reward system. When dynorphin is released, it often produces effects that are opposite to those of dopamine. Rather than enhancing reward, dynorphin can reduce dopamine activity, leading to decreased motivation and feelings of discomfort or unease. This makes dynorphin a key regulator of emotional balance. It helps prevent overstimulation of reward systems, but it can also contribute to negative emotional states when overactive. One of the most important conditions associated with dynorphin is depression. In depression, increased dynorphin activity may contribute to reduced dopamine signaling in reward pathways. This can lead to anhedonia, where individuals find it difficult to experience pleasure. Activities that would normally be rewarding may no longer feel meaningful. This highlights the role of dynorphin in shaping emotional experience, particularly in reducing positive affect. A second condition linked to dynorphin is addiction. Dynorphin plays a complex role in addiction. During repeated drug use, dynorphin levels can increase as part of the brain's attempt to counteract excessive dopamine activity. However, this can lead to a negative emotional state when the drug is not present. This contributes to withdrawal symptoms, including low mood, irritability, and reduced motivation. As a result, individuals may continue using the substance, not to feel pleasure, but to avoid negative feelings. This shows how dynorphin is involved in the shift from reward-driven use to compulsive behavior. A third important condition associated with dynorphin is stress-related disorders. Dynorphin is released in response to stress and plays a role in regulating the body's response to challenging situations. However, chronic stress can lead to prolonged dynorphin activity. This can contribute to feelings of anxiety, dysphoria, and emotional exhaustion. In conditions such as post-traumatic stress disorder, dysregulation of stress systems may involve altered dynorphin signaling. This can affect how individuals process and respond to stress over time. Another condition linked to dynorphin is chronic pain. Dynorphin is involved in pain modulation, but its effects are complex. In some cases, it may contribute to increased sensitivity to pain, particularly in chronic conditions. This suggests that dynorphin can influence both the perception of pain and the emotional response to it. This again highlights the connection between physical and emotional processes. There is also evidence linking dynorphin to anxiety disorders. Increased dynorphin activity may contribute to heightened stress responses and negative emotional states. This can lead to persistent feelings of unease and difficulty regulating emotions. From a broader perspective, these disorders illustrate several key principles. First, dynorphin is part of the brain's opioid system, but its effects differ from those of endorphins and enkephalins. Second, it plays a key role in regulating stress and negative emotion, often by reducing dopamine activity. Third, balance is essential. While dynorphin helps prevent excessive activation of reward systems, too much activity can lead to dysphoria and reduced motivation. There are also important implications for treatment. Understanding dynorphin has led to interest in targeting kappa opioid receptors as a way to treat depression and addiction. Reducing dynorphin activity may help restore balance in reward systems and improve mood. However, this area is still under investigation. It is also important to evaluate dynorphin explanations carefully. Disorders such as depression and addiction involve multiple neurotransmitter systems and environmental factors. Dynorphin is part of the explanation, but not the whole story. Despite this, its role is increasingly recognized as important. So, what is the key takeaway? Dynorphin is a neuropeptide that regulates stress, pain, and negative emotional states. When its systems are disrupted, it can contribute to conditions such as depression, addiction, stress-related disorders, chronic pain, and anxiety. More broadly, these conditions show that the brain's reward system is not only about pleasure, but also about balancing positive and negative experiences. So the next time you feel stress, discomfort, or a lack of motivation, remember this: dynorphin may be influencing how your brain is responding. And when that system becomes overactive, it can shape how we experience both emotion and motivation. A powerful reminder that the brain's chemistry includes not only signals of reward, but also signals that help regulate and sometimes limit it.
If you enjoyed our channel, please click subscribe.